Welcome to the most joyous webinar you're going to have in January, I'm sure, and maybe for the whole of this year, because today's Art of Nursing webinar is all about how we bring joy and how we ensure that the young people, the next generations who are going to be taking on our legacies, our lives, have joy in their lives at the moment. We're the custodians of this planet and the custodian of our children, and yet not all children have the opportunity to live their life to the full. They have the aspirations. I'm a respite foster mum and I'm a nurse, and the invitees to this webinar today bring what I can only describe as the theory behind, the practical bits behind, but the heartfelt work of bringing joy to young people and working through health research communities to make sure that that joy is spread elsewhere as well. So if that's the wrong webinar that you want to be on, if you want to be on something about how to use Excel or Davos the disaster or some public policy sharing document, please go. If you want to share in the joy of what it is to be a nurse and how we bring joy when we work with other people as well, stay and learn, because oh my goodness, what you're going to actually hear about today is wonderful. There are no slides. Another bit of joy. There will be no PowerPoint power plays. There will be nothing but a human conversation with women who get stuff done, sharing how they do it and why they do it. We're going to end at 1:45, so you even get 15 minutes back. Another bit of joy. We've had to curtail the session, and it's an invite to engage with our guests as well. Our guests, we have two, they will speak for about 10-15 minutes, and then it's 5 minutes of question and answer. So again, a bit of joy. Please do ask, please do comment, please do make this a fireside chat that it's aimed to be. This is not a lecture. This is not a lesson to be had. This is a joyful day to actually start to engage with the momentous work that's happening across the world. And so with that in mind, I'm Marion Lynch. I'm the CEO of Art in Nursing Community Interest Company. Sarah is here. She's museums lead at the RCN, and we run these webinars. We've been going now 1.5 years out of passion. No one gets paid to do this. I don't get paid to do this. We do this because we want to show how the arts help health and how nurses can be involved in the arts. So with that in mind, we've got to 13:03. So people who have gone, oh my goodness, I forgot I'm supposed to be on this, probably have arrived. And I'm going to introduce our first conversation. I'm going to give it, the platform, because no words I can put in, I'm almost crying just speaking it, no words I can say will do her justice, because the work is phenomenal. And as a global health consultant as well, this is actually the work that really, really brings my heart to the surface and makes me smile about what's possible. So over to you, Sylvia.
Thank you so much, Marion. Thank you for the very warm introduction, and hello, everyone. It's really a pleasure to be here. I'm happy to talk to you about our organization and our work. My name is Silvia De Faveri, and I'm the Research and Learning Manager of Renosis International. Renosis International is an artistic organization that brings humor and joy to people in need of joy through the art of healthcare clowning. So we are an organization of healthcare clowning, and we offer a variety of artistic interventions through our professional clowns. in a number of different contexts, such as for children in hospital, older adults in care homes, people with disabilities, but also forced migrants, healthcare staff, nurses and doctors in hospitals, and also field workers who work in humanitarian contexts. And today I'm here to talk to you about our research project in Lesbos, our research project involving children and people on the move, in order to understand what is the impact of our artistic activities on the well-being of people involved in forced migration. So let me just talk a little bit more about Renosis first, and also our program in humanitarian contexts. We are an international organization with 11 working in 11 countries. We have 11 partner offices in Europe and the Middle East, and we work with more than 500 clowns and more than 700 medical institutions and medical and social institutions. And part of our work is also bringing joy and humor to people who are involved in displacement and in forced migration. And our program in humanitarian context, is called Emergency Smile. And it's a program with the aim to bring joy and promote the emotional well-being and resilience of people living and also working in humanitarian environment, humanitarian very stressful environment and hardship contexts. How does it work? We have a team of clowns. We usually have 3 professionally trained clowns and the head of mission who visit a humanitarian context for around a month or multiple months throughout the year. And the clowns bring a number of formats and involve the participants and children in their artistic activities in order to bring joy and to really include everyone and to give people again the opportunity to connect with their playful self, because let's remember that in these contexts of often people really forget even children forget about the most basic things, and even playing becomes really, really hard. So this is really what we give them back. We give them back a safe space where they can really express themselves, connect with each other, and just laugh and have a great time and connect with their positive emotions. How do we do that? The clowns have a number of formats. So they do interactive clown shows with the children, during which the children participate. There are props involved. It's very interactive. There are musical parades. And there's also what we call Circus Smile workshop. And it's a workshop during which the displaced children have the chance to learn some circus skills. So they work with props, but they also learn magic tricks and acrobatics. They do these activities for 3 months in group. So it's also a way really to bring people together and communities, different communities together. And at the end, during the last day, there is actually a show where the children are really the protagonists, and they're there showing to everyone, to the field workers, and also to their family members, what they have learned. And the clowns really put up a big show, as in a circus. We also have, the clown also do what we call humor relief workshops. It's a workshop that is led by a clown, professional clown. It's a 2-hour workshop for field workers, but also for nurses and doctors, medical staff, and also for volunteers working in emergency settings. And this workshop aims to improve the emotional well-being, but also the teamwork of the field workers working in displacement settings, and also to teach them skills on how to best use humor during their daily work. And it's also a great tool to connect teams and work on their team bonding. Let me just say, well, just a little bit of an idea where we've been working during the last year. We have a lot of missions. Our Emergency Smile Clowns really travel to different locations and different humanitarian contexts. Some of the places where they've been are Turkey and Morocco after the earthquakes, Georgia, Moldova, of course, Italy and Greece, and we will talk about that in a second because this is where I want to focus. But also we work with partners in several African countries. For example, recently our emergency smile team was in South Sudan with our partner Light for the World. Yeah, so I think it's important to understand why we are bringing clowning in such a hardship context. And it's actually because we believe that this is actually where clowning is needed the most. And clowning is a highly adaptable. It can really take place anywhere, in any context where there are some basic safety, where basic safety is ensured for the participants and also for our team. And because clowning really creates this immediate language-independent connection with children and young people. And these activities can either stand alone or they can be of support to organizations in the field that have programs with people involved in forced migration. When we go to the field, we always work through our partners who give us access to the audiences, and it's a really, really close collaboration. And our clowning and humorous activities often go hand in hand with the activities of our partners in the field. Yeah, so I want to talk today about our research project because we can see ourselves. We have been seeing for a long time. Emergency Smile has been going on since 2013. We have seen the impact that we have on the children and on the communities. And we have heard feedback from the field workers, from our partners in the field who always call us back. They always ask us when we're available, when we can go again to support their activities, because they have actually seen firsthand what impact our clowning activities and humor can have on the atmosphere, on the community, but also on the field workers. And we've done some internal evaluation on the impact that we have, but then we really wanted to bring it one step forward, and we really wanted to understand what is the impact of artistic humorous activities on the well-being and mental health of people involved in forced migration and also people working in humanitarian context. So we decided last year to start a 3-year research project. And this research project is happening in Lesbos. And why Lesbos? Well, because our Red Noses has been in Lesbos since 2018. Doing regular missions throughout the years. So this is where we can actually see also the most long-term effects. And we have built a very strong collaboration with partners in the field. So this is really where we feel we are able to collect data in a stable way. Because we know that this is actually one of the challenges of doing research in humanitarian context, is actually that it's a very volatile context. So let me tell you a little bit more about our research project. As I said, the goal is really to understand the impact that our clowns have on the well-being of the children and on the well-being of the field workers. This is a project that is done in collaboration with a few international institutions, and we're very proud of our collaborations with the Jamil Arts and Health Lab, with the WHO Office for Europe. And also we collaborate a lot with the grassroots organizations in Lesbos, organizations that support migrant children when they come outside of the reception centers. The research is not done by us, it's led by an external researcher, by Dr. Eliana Alice Salvadori. She has a PhD in developmental psychopathology, and she was also volunteering as a clown herself during her youth. So it's really, we immediately felt that she was the perfect lead for our project. She totally understands our context and our work. And she has a wide net of collaborators. She's collaborating with universities in Europe and in America. For example, the University of Athens, La Sapienza University of Rome, the University of Miami, the Lusofono University in Portugal. So it's really work like a teamwork. It's a big project. And for those interested a little bit more in the research methodology, this is a quasi-experimental mixed method research. So it employs qualitative methods such as interviews, focus groups, and also drawing activities for children, because of course we have a lot of child-friendly tools that we use to engage with children in this research project. There are also quantitative methods, including standardized questionnaires and child-friendly questionnaires. And also physiological tests. So we use smartwatches to measure physiological data, such as the heart rate while filling in the questionnaires. And we really have framed this research project into positive psychology, because we want to focus, to shift the focus from stress and burnout that field workers and also children can experience in the field and often experience in these situations. And we wanted to shift it to social emotional well-being. So we really ask about and we want to understand what's the intrapersonal functioning, what's their emotional regulation, their sense of belonging, but also what's their sense of gratitude and social connectedness, and eventually also what's their positive and negative emotional states, quality of life, and life satisfaction. So these are all standardized questionnaires that we use to understand a little bit the impact that we have. So far, we have started collecting data with the field workers, and I'm really excited to share that we had 76 respondents in 2025. And we're continuing collecting data also in 2026. So this is ongoing right now as we speak. And later this year, we're also going to start collecting data from the children. We're working with an organization that supports unaccompanied minors and hosts unaccompanied minors in their structures outside the camp. The organization is called Ilia Catida. They're our long-term partners in Lesbos. And we'll be using, as I mentioned, child-friendly surveys, and we will be doing some drawing activities, drawing tests with the children. Later last year in 2025, we also had a pilot with the 3 children in Lesbos. To understand how they responded to the tools and what were their feedback. So it was really about involving children from the early stages of the research. The children really helped us understand what works best, what they would prefer to do. So it was a really important step of the research project. And now based on this pilot, we are actually finalizing the protocol for the research with the children. Yes, and I think that I really wanted to give you a little bit of a picture, a broad picture of what we're doing in the field. So we're always trying to mix humorous, artistic activities on the one hand, and scientific activities on the other, scientific research. Our work is very much grounded on scientific research, and there's an ever-growing literature on the impact of artistic activities on the well-being of the participants. Although the literature is quite scarce when it comes to humanitarian contexts, because this is quite a volatile context and it is difficult to collect data regularly. And this is where our research actually fits. We really saw a gap in the literature, and we really wanted to work a little bit more in trying to understand what is the impact. And we hope that this will support the use of more and more artistic activities in hardship context, in crisis context, to really give as much support as possible to people involved in migration and people working in a humanitarian context. So thank you so much, and I'm really curious to hear all your questions. Thank you.
Thank you so much. And please put your hand up if you've got a question, or put a comment in the chat, because there's something that I've heard today that really, as a nurse nerd, puts any of the challenges I've ever had in research or in conversations into context. But the key for me is that this kind of work is a dividend lens. What is the positive elements rather than a deficit lens, which always looks at the injustice. We're talking about joy, not injustice. And it's also looking at humour, not harm. So this this other side of the coin all the time is where the joy comes from. And I have to say, having been in many quality improvement initiative conversations in the NHS and trying to show the invisible skills of nurses in many of my conversations, you're doing the hardest thing here to actually, but the most human and the most important, because without our next generation and without their sense of belonging, community and health, etc., what are we actually trying to do here? You know, so clowns have been, and humor has been the way before we invented health systems. So this is just a joy to me. Humor in humanitarian context to develop well-being, smart watches to measure heart rate, drawing activities. Gosh, anyone who's listening to this who think you've got issues with convincing finance people or an ICB about things, look what is possible. Look what actually is happening in places that you would imagine it would be impossible. It is possible. So with that in mind, are there any hands up there? I can't see them, Sarah. So
No hands up or questions yet. But it might take people a bit of time to type something.
Yeah, it's just too amazing, I think. So I'm going to ask you a question. What keeps you going? I'm going to do the deficit model. What keeps you going when people say you can't?
Well, I have to say that for our clowns who work in the field always come back with such heartwarming stories. And they hear them first person. And then, of course, we in the office here in Vienna, we hear them through the head of missions. And we can really touch at first hand the impact that we have there. And we had one father of a child in one of the structures where we work in Lesbos, coming to tell us after our activities, really coming to thanking the clowns and saying that it was the first time that he saw his daughter smiling after more than a year. So it's really about connecting children to what they're supposed to do. It's really about playing. It's really about giving them back a little bit of that feeling of feeling safe that they have long forgotten, maybe. So I think that this is the most important thing. And this is always the treasure that accompanies the clown when they come back. And also, of course, we have it at heart very much. And I think it's the most rewarding feeling, really.
I could see it in your face, and when you use the word treasure, that actually is a word that I don't hear in any NHS policies. I don't think treasure, treasury maybe, but not treasure. So we've had two questions. One is about the age range, and another person has asked for a picture. I'm going to put that on a sidebar because there will be links in the chat that you can go to see the whole of the service. Okay, so you can go and see and experience it in another way. But just one final question before we move on to the next person. What age? So a quantitative one, and then how do you get over maybe some negative connotations of nursing depicted as scary or that kind of thing? So two questions. Sorry.
Thank you. How we get over? Sorry, could you say that again?
So in some cultures, clowns are seen as scary.
Thank you so much. Yeah. So first of all, about the age range of the children, I guess, because on the one hand, we work with the field workers and we collect data with them to see the impact on them. And then with the children, we actually had to select an age range. We selected from 8 onwards, from 8 until 17. Because this really allows us to use some questionnaires that are actually understandable. It's an age where children can better understand the questions and also the time span. So cognitively, also these surveys are actually are better suited for a little bit older children. And also because we will actually engage with them in interviews, and we believe that this is the age that would allow us to collect more richer information. About the cultural, the different understanding of clowning, this is a really, really interesting aspect. And I have to say that we have some different feedback. especially when we go to some African countries where clowning, for example, is not a very common figure. So we have a lot of people really surprised at first, but then surprisingly, you will be surprised to know that people react absolutely in a positive way. They laugh so much at the clowns. And the clowns have this really quiet and delicate way of connecting with the people. So they are very good at reading the situation and boundaries and how people are reacting. And they take it very, very slow to be accepted within the group. They also know their limits and what is possible to do or not. And at the same time, I should also say that our clowns, they go through a very, very long education process. And they do every year constantly a lot of workshops to improve their artistic skills. And so they also have regular workshops that are about cultural diversity. Which is, a central aspect, especially when working in a humanitarian context. So these are all topics that are very at heart, and we really work on them regularly. Yeah.
Thank you. In nurse language, we call this sympathetic presence, or the creation of presence. And this is where there's a sort of common space, being able to judge a space and a place and a person, and calibrate yourself to who and where you are. That's a sort of a nurse way of knowing as well. And this is why there's creative health and creative aesthetic ways of knowing links across. So thank you. Kim's just noted that this is a great way, and is particularly great because of this co-production with young people. So thank you so much. We could talk all day, but I need to bring us now to specific work that's happening in 2026 in the UK with the Reading Agency, and move on to our second guest, which is Gemma, who is Gemma, who's going to tell us about specific things that are happening in the UK. Again, joy and children, and the work that nurses could and creative health people could start to get involved with. I appreciate we've got an international audience, but please, this is work that can also be linked across what Sylvia said and our work in the next webinars, as in April we'll be speaking with Michael Rosen as well. So this will all link in. He's the amazing children's author about how stories help health as well. So Gemma, come on. I'm so excited about what we can do for the year of reading.
Fabulous. Thank you, Marion. And just to say thank you, Sylvia, that was absolutely fascinating. And as someone who's terrified of clowns, that feels like a really interesting way to see how you use clowning. So some great questions there. So my name is Gemma Jolly. My name works quite well for a feeling of joy, I suppose. So yep, there's that to it. And I'm the head of health and wellbeing at the Reading Agency. So I'm here to talk to you about reading and how reading can support health and wellbeing, and particularly highlight some programs and some work that's going on, and also give a bit of an insight into 2026 as the National Year of Reading across the UK. So before I get started, just a bit of context about the Reading Agency, because you might not have heard of us. So we're a UK charity. We work across the UK, and we're all about inspiring social and personal change through the proven power of reading. So we aim to share the transformative benefits of reading for happy, healthy and thriving lives. That's what underpins a lot of the work that we do. And so I've kind of set my talk, my chat up across sort of 3 different areas. So I wanted to start with why we focus on reading and a bit about the evidence base, because it's something that I often get challenged on around reading and how it fits within sort of the health and wellbeing space, and also how it fits within the creative health space. And I think it's really important to say there has been a lot of research over the years, so we're not coming at this blind. There is a significant amount of research around reading to support people's health and wellbeing. And I'm just going to pick out some highlights. So things like reading for pleasure, so that's where you choose to read, you're not being forced to read, but is linked to feelings of positivity, self-understanding, empathetic relations, self-efficacy, emotional intelligence and connectedness. And if you read for just 6 minutes a day, research studies have shown it can reduce your stress levels by 60% by reducing your heart rate, easing your muscle tension, and altering your state of mind. So compared to non-readers, regular readers, and by that we mean people who read at least once a week, but it's a really broad definition of reading. So it includes e- and audiobooks, physical books, comics, newspapers, journal articles, graphic novels. But people who read any of those once a week are 32% more likely to say they don't feel anxious or depressed. So there's a really positive impact on people's well-being from that side of things. It can also support positive mental health and better sleeping patterns. And we know that sleep has a big impact on how people feel. And then specifically looking at the benefits for children and young people, because they are significant. But the most common motivation for reading amongst children aged 8 to 18 is to relax. Reading in childhood is linked to higher mental well-being and resilience in adolescence. So sort of that long-term benefit of reading in your childhood. It's been associated with positive social behaviour and fewer emotional difficulties in children. Again, linked to better sleep, reduced attention problems, lower screen time, which is obviously quite a big topic at the moment with everything that's going through the UK Parliament at the moment. It's really good for child bonding. So there's evidence that shows shared reading and reading together really strengthens parent-child relationships, or even even child-carer relationships. It doesn't have to be a parent, but anyone that they're reading with. And it helps children to feel happier. And, you know, that's what we're all about. We're all about joy and happiness. And there is evidence that shows reading helps children feel happier. Very much that reading for pleasure side of things. I think as soon as it comes into that being forced into reading, that's when it becomes a bit trickier. And that's sort of what the National Year of Reading is going to be tackling this year. But I'm going to come on to that in a moment, a bit later. I also wanted to flag libraries, public libraries particularly, but all types of libraries. So we work really closely with libraries. They're a really important community asset. I don't think they get the love and attention that they often deserve, and they are places that bring people joy. They are free. They are one of the only non-transactional spaces left in our communities. You do not have to pay to go into a library. You don't need to do anything. You can just go in and sit down and read a book or listen to an audiobook or just sit and be and watch. So they are a free community space. And they're trusted. So evidence says that librarians, I think, is the third most trusted profession after doctors. I can't remember what the second one was, but yeah, they're up there. So they're really important professionals, and they're very much trusted by their communities, which I think helps to position the library as a safe space for people. They also are a real asset to community health and well-being. So public libraries are all signed up to that's something known as the Public Library Universal Health and Wellbeing offer across England and Wales. In Scotland and Northern Ireland, they have their own version of that offer. And that's all about sort of setting themselves up to support their community's health and well-being. They're not just spaces where you borrow books. There's so much more to them. They run a range of sort of health and well-being activities, from sort of book lists and signposting to organisations to events, things like Baby Rhyme Time, and Knit and Natters. They have health equipment lending. So a lot of libraries now lend out things like blood pressure monitors, or you can go and get your blood pressure read and that kind of thing. There are instances of community health organisations using the library, because for people who don't feel comfortable accessing health professionals, the library can be a safe way to get them to access those professionals. So they really are doing a lot, and I think they don't get the attention they deserve. And so in the aim of bringing joy, I just wanted to flag libraries. And also they're really important for children. It's where children often learn a lot of their first autonomy, going in and picking those books, that kind of being in control of what you get to read. It's a real joy for children. So in terms of a couple of specific programs that we run as the Reading Agency, I wanted to flag our Reading Well program. So Reading Well is a national books on prescription program. It's available for free across public libraries in England and Wales. In Wales, the books on the lists are available bilingually, as are all the supporting materials. In Scotland and Northern Ireland, the books are available, but they're not a universal offer. So it's not quite the same as it is in England and Wales. But the programme is all about helping people to understand and manage their health and well-being using recommended reading. So we work with people with lived experience of the conditions we're working on, and health professionals, including nurses, and we always have representatives from RCN on our book selection panels, to read and review books that are targeted at supporting people's health and well-being. So we've got 5 book lists covering different topics, but these are topics where the evidence shows us that reading can have an impact on people's health and well-being. So there's 4 on mental health, 1 for adults, 1 on sort of perinatal mental health, particularly the first 1001 days. one for teenagers, so really kind of looking at some of the challenges that teenagers face, be that, you know, social anxiety, sexuality, neurodiversity, and providing them reading resources to help them understand kind of what they're going through and give them tools to help themselves look after their well-being. And Reading Well for Children, which is aimed at Key Stage 2, so 7 to 11-year-olds. And that's very much aimed to sort of, I suppose, encourage conversations between children and their families, carers, anyone in their support network, to try and help address kind of things like worries, any anxieties they might have, and try to introduce them to talking about their sort of emotions and how they're feeling, which is really important. And we also have a book collection on dementia, which includes a selection of books for children, which explains what dementia is, to try and help them understand what dementia is if they've got someone in their life that's affected by dementia. So it's very much all about giving people tools to empower. It's not about replacing any clinical care or that kind of thing. It's like an extra string to the bow, and really trying to support that kind of self-management, shared decision-making, getting people to sort of engage with books and reading that might be beneficial for them. They can either be signposted to the books by a professional, or you can just go into the library and get them. And that also includes the online catalogue, so ebooks and audiobooks. You don't even have to go into the library. You can download that for free and get hold of them. The programme's been going since 2013, so some overlap there with Sylvia's thing. 2013 was a good positive year. And in that time, over 4.3 million Reading Well books have been borrowed from public libraries, and 100% of children would recommend their book, and 97% of teenagers, when surveyed, said that they would recommend their book to a friend as being really helpful. And we're always looking for people to get involved. So if you think Reading Well is something that might be beneficial for you and where you work and that kind of thing, do reach out to us, get in touch. We're more than happy to help support set that up. We've got pilots going on around the country with different health professionals to try and embed Reading Well and books as part of the support offer, and I'll pop some links in the chat afterwards. And then a couple of other things I just wanted to flag that we do. So we run the Summer Reading Challenge, which you may have heard of. It's the UK's biggest reading programme in libraries for children. Every year we reach around 700,000 children, and it's all about supporting people to continue their reading, their love of reading, or start them on a love of reading between the school holidays. Aimed primarily at primary school children, so 4 to 11, but there is an early years offer for younger children or siblings if you've got someone who's 4 to 11 going into the library and you want younger children to get involved. And also there's a volunteering offer for teenagers to support them to engage with the programme as well, which often gets used for sort of Duke of Edinburgh Awards and that kind of thing. Over 90% of libraries in the UK take part, so most libraries will be doing it. There's lots of ways to get involved. We're always looking for volunteers. If you go into your library in the summer, you'll see lots of activities and events. And this year's theme is around music. So there's going to be lots of musical activities going on in libraries. So if you've got children or if you're just interested, do check out the library. We also on our website have a wide range of book lists. We know that often people may, if they're not a regular reader or they lack confidence in deciding what to get into, we have a whole range of book lists on our website, and we produce books called quick reads, which are short reads by well-known authors to support people who may have got out of reading, may not feel confident reading, to get them back into reading. So I'll put a link on to our website in the chat so you can go and explore all of that. But yeah, if you're looking for your next read, there's loads on there. There's loads of joyful reads on there. So yeah. And then the final thing I wanted to talk about is the National Year of Reading. So 2026 is the third National Year of Reading we've had in the UK. It's a UK-wide campaign. It's designed to help more people rediscover the joy of reading. There's been a really steep decline in reading across the UK, particularly reading for pleasure over the last few years. So some research that was commissioned as part of this has shown that only 1 in 3 children and young people say they enjoy reading at the moment. And 1 in 2 adults don't regularly read. So we know that there's a real challenge. We know there's a lot of benefits to reading. So it's all about getting everyone to re-engage with the joy for reading. It is for everyone. It's very much targeted at all ages. Everyone can get involved in the National Year of Reading. But there is a particular focus on 0 to 5-year-olds, boys aged 10 to 16, and low-income families. And that's because the decline in reading is most evident in those groups. So there's going to be some targeted activity. The focus is all around go all in. So it's about bringing reading to the people. It's not trying to make people go to reading. I think the view from the design or marketing agency or someone was that reading had an image problem. So they're trying to try and change that. And it's all about highlighting how reading can support people's passions and interests. So the sort of slogan is, if you're into it, read into it. And you'll see there's lots of stuff about sports and music and things that are going to feature throughout the year. And it's all about making reading relevant, engaging new audiences, and creating a modern legacy for reading. There will be events and activities throughout the year that you can get involved in. I would just caveat that with, we're in January, it's quite early in the day, stuff's still getting worked out in the pipeline. But things like World Book Day, the Summer Reading Challenge, there's going to be a moment in October around mental health. You can find out more at goallin.org.uk, and I will pop that in the chat in a moment. A particular focus of the year is volunteers. So if you are interested in any way, there will be lots of opportunities to volunteer, both sort of social media volunteers, but also much more active volunteers about bringing reading into workplaces and also going into communities and supporting reading activities there. The big ask on people to spread the word, so tell your friends, your colleagues, just shout to everyone that it's National Year of Reading, you know, shout from the rooftops how great reading is. They're really interested, or some of the ideas they've got for ways people can get involved is sharing what you're reading. We do it at work. In my work signature, I have what I'm currently reading, and the amount of conversations that triggers on email just about what I'm reading and book recommendations I get. So it's a really nice thing you can add in. Doesn't take anything, and you get some great book recommendations, but it also sort of builds rapport and has really helped with some relationship development from my perspective. And then creating sort of shared book spaces at work or in the community. Obviously, libraries are great, but we know libraries closing down. They're not always that accessible. Where I live, we've got a little book nook down the end of the road, so people are always putting books in and out. So things like that, they're really trying to encourage people to get involved with. We're encouraging people to connect to their local library. So if you've not been for a while, if you don't know where it is, you can go online and find out where your local library is. Pop in, see what's going on, have a chat. Sometimes you can have a cup of tea or coffee. And then, yeah, as I said, on World Mental Health Day, they're doing Take 10 to Read. So it's all about bringing people together to share reading and stories. More details about that will be coming out. So you can sign up to receive regular updates on the website, and I'll put the link in the chat. But yeah, October's going to be a big moment about reading for mental health and well-being, and particularly, you know, taking 10 minutes out of your day to read and how that can build connection. And yeah, I'm going to stop there, but hopefully that was interesting.
Thank you so much. Yeah, I am on. Thank you so much, Gemma. I've been writing these notes down, and then wondered, does the RCN have a book club, a nurse book club? I don't think. Well, if they do, I wish I was in it, and if they don't, I'm just thinking maybe Year of Reading is the moment that we start to do that. Not just about the health books, as you say,
Yeah.
but the joy books as well.
Yeah.
Because I can't. As soon as we start thinking about this, I've got those positive memories of World Book Day and my mum, and also the competition of who's got the most, you know, wonderful outfit. And I remember Skellig, because you just needed a black bin bag and some moss and cobwebs, because it was the imagination, the Amazon order that actually made it alive and wonderful. So thank you so much for that. You've put up the links in the website. Kim has reminded us that nurses are the most trusted profession. We have to.
How did I forget that? Sorry, everyone.
How could you? It's however, nurses in unison with librarians. My goodness, how could that actually start to really do work on illness prevention and public health and health literacy? So if there's a briefing that we could start to send to our public health colleagues, that would be amazing, and our school nurses, so that we can say, actually, here it all is on a page of A4. Let's get not just people reading for pleasure, but reading for health as well into the kind of conversations. That would be wonderful. As I'd love that, and I can put that on the Art of Nursing community interest company website as well. So there's a list, there's such a list of action to do, and we've reached 13:44, and we've still got people on the call. So if there are no comments, I'm going to summarize some of the action points going forward, and then signpost people. So people, if you really do want some joy in your life, and I have to say, as a nurse of 40 years, I really could do with it. At the moment, this is how to get it. Engaging in health literacy and public health of the next generations, that'll be the generations after that, and using creative health endeavours to do this. So top tips, people listening, if you're not already engaged in the special interest group Nurses and Creative Health, please join. It's only just launched. Just Google special interest group Nurses Creative Health. Sarah might put the link in. We're going to be having workshops in May. We're going to have an exhibition at Claw Learning Centre, Kensington Palace in May. Nurses being seen, being heard, being, using the creative health. We've got 2 more Art of Nursing webinars to go, and then that's it. Our next one is quickly looks at notes, 5th of March. That's new musical notes on nursing. This is about how music helps us care as nurses, and how music is being used in nursing and in other social and community groups. There's also evidence of how the impact is being evaluated. So, you know, when Sylvia talks about emotional regulation, cortisol links, etc., this is exactly what happens, as well as COPD approaches. But also the joy of being in a choir and the sense of belonging. And then on the 23rd of April, we have, in conversation with Michael Rosen, bringing his experiences of being a patient during COVID in ITU, and then experiencing rehabilitation, how he turned that into his book, Other Ways of Knowing, and linking the idea of reading and writing and researching all together to show that creative endeavours and creative health have a proven effect on our well-being, and also our social well-being, also our country's well-being. It adds to not only our own individual, the nerdy word is capital, and cultural capital, but the human capital, the way that our economy actually runs as well, the social return on investment. Those arguments about evaluating the impact can be a whole other session. But for now, what I'm going to say is, if you feel better from having listened to this and feel more motivated and able to do your own research and your own projects, because, oh my goodness, if it can happen in the most challenging areas where humanitarian priorities are there, and if the year of reading can show us just the impact, but the gap where 1 in 3 children don't like it and 1 in 2 adults don't do it, but the effect on your health by just 6 minutes a day, gosh, if it was a pill, we'd be giving it, we'd be putting it in the water, wouldn't we? Then your work must be possible. So with that, I'm going to end us, because we're on 13:47 and we need to give our Zoom away elsewhere. Thank you so much for everybody. Do please fill in the feedback that Sarah's just put up. Oh, and it is joyful. Yes, an absolutely joyful event today. Please have a great, in UK, grey rest of January, and join us for new musical notes on nursing. No apologies to Nightingale people for saying notes on nursing differently, and our conversations, and join this special interest group. We need you, those in creative health, in education and in nursing, to actually spread this joy as well. Thank you, everybody. Bye-bye.